Hello, and thank you for joining this presentation centered around the fiscal and quality of care benefits associated with skilled nursing certifications provided by the American Association of Post-Acute Care Nursing, or AAPACN. My name is Michael Bynes, a Senior Research Associate at Dobson DaVanzo Health Economics Consulting, and I will be guiding you through the presentation today. My other team members who worked on this project with me are listed on this slide. Before we begin, I would first like to thank them for their contributions to this work, and I would also like to thank Tracy Moorhead and Amy Stewart of AAPACN for entrusting our firm with this work and providing guidance and quality assurance through each step of the process. With that, I will go over our agenda for today. I'll start with a few slides covering our executive summary, which will provide the high-level key findings of our analysis. I will then highlight the quantitative and qualitative data used. If you would like more detailed methodologies, calculations, or findings from the qualitative analysis, I would encourage you to examine the appendix, which is located at the end of the PowerPoint slide deck. Following the data section, I will get into the findings of our analysis, starting with the quality outcomes before turning to the financial outcomes. We will conclude this presentation with a short conclusion and discussion section. The next 3 slides will detail the key findings of our analysis. Key data points in this section are related to facility representation, health deficiencies, quality measures and CMS Star Ratings, and financial indicators such as profit margin, civil monetary penalties, staff turnover, and value-based purchasing multiplier reimbursement. Now on to the executive summary. The number of facilities employing an AAPACN-certified nurse has grown steadily between 2022 and 2024. Overall, there has been a 16% increase in facilities employing an AAPACN-certified nurse in this time period, growing from 2,138 facilities in 2022 to 2,480 in 2024. This would suggest that facilities are seeing value in employing nurses with AAPACN certifications. Facilities employing AAPACN-certified individuals consistently demonstrated better health and quality of care outcomes as compared to facilities without a certified nurse. The percentage of facilities with a health deficiency was 1.27 percentage points lower for facilities employing an AAPACN-certified nurse, and these facilities had 10% fewer overall health deficiencies as compared to facilities without a certified nurse. The majority of quality measure indicators were better for facilities employing AAPACN-certified nurses, with 7 of the 18 quality measures being at least 2 percentage points better. Facilities with an AAPACN-certified nurse are demonstrating improvements in their quality measures, as 12 of the 18 quality measures were better in 2024 than they were in 2023. CMS Star Ratings were higher in every category except the long stay quality measure rating, which was equivalent. However, as we extended the decimal point out, we can see that facilities with an AAPACN certified nurse still scored higher in the long stay quality measure rating as well. Facilities with a certified nurse were highly concentrated in the 4 and 5-star CMS rating bands, with 42.24% of facilities with an AAPACN certified nurse comprising these higher star rating bands. Conversely, 47.25% of facilities without a certified nurse were in the 1 and 2-star rating bands. We also found that the more AAPACN certified nurses a facility has on staff, the better their CMS Star Ratings. CMS Star Ratings were higher in every category for facilities with 2 or more AAPACN certified nurses than those facilities with only 1 certified nurse and those without any certified nurses. One thing we did notice from our analysis is that CMS Star Ratings have been decreasing overall since 2022, and this is for both cohorts. Results for our qualitative analysis suggest that CMS may be attempting to depress star rating measures through methodological changes for various reasons. One factor in the better quality measures and CMS Star Ratings is that facilities with AAPACN certified nurses have higher nursing staff hours per patient per day as compared to facilities without a certified nurse, and this allows for more personalized and attentive care for the residents of these facilities. In terms of the financial analysis, we found that net profit margins were lower for facilities employing AAPACN-certified nurses, likely due to increased staffing costs associated with employing more and better qualified nurses. Despite the lower profit margins, all other financial indicators suggest that investing in AAPACN certifications for nurses in a facility demonstrates a positive return on investment. Facilities with AAPACN certified nurses had increased census or facility capacity, lower employee turnover rates, and fewer civil monetary penalties than facilities without a certified nurse. Value-based purchasing multiplier rates were also higher for facilities employing AAPACN certified nurses, which contributes to increased revenue. When examining the financial indicators, it is important to note that things like civil monetary penalties and VBP reimbursements are not indicated on a facility's cost report until future years, as the process for identifying and appealing CMPs can take months to years to complete, and reimbursements often come years after they are earned. So although these financial indicators favor facilities with AAPACN certified nurses, they may not be contributing to revenue or costs on the 2024 cost reports, which is used to calculate net profit margins. Now that I have provided you with the high-level findings of our analysis, I will go over the data sources used for this analysis. As a reminder, if you would like more detailed calculations or results of the qualitative analysis, you can go to the appendix of the slide deck to find that information. We performed our analysis from 2022 to 2024. We performed 3 years of analysis mainly because the SNF LDS claims data from our previous analysis in 2023 and the 2022 analysis provided by Inovalon was not fully adjudicated at the time of those analyses. Given that 2022 to 2024 data is now fully complete, we chose to conduct analysis of all 3 years to provide the most accurate information possible to AAPACN. There were 4 quantitative data sources used in our analysis. The first is AAPACN-provided certification data, which lists the nurse IDs and facilities in which nurses with AAPACN certifications are employed. The SNF LDS claims data was used for facility representation percentages and the denied claims analysis. The SNF cost report data was used for profit margins and calculating the proportions for civil monetary penalties. Finally, CMS publicly available provider data via CareCompare was used for the majority of the analysis, including the quality measure and star rating analyses, civil monetary penalty analysis, staffing measures, and VBP reimbursement analysis. As part of this project, we also conducted semi-structured interviews with key informants. The interviews were used in the report to provide further credence to the quantitative analysis and additional nuance needed to understand the trends we were seeing. The qualitative process included developing interviews, conducting interviews, transcribing interviews and thematically coding responses, and finally analyzing various themes and sub-themes. The hierarchical list of themes and sub-themes derived from our qualitative analysis can be found in the appendix. The first main section of our presentation will go over care quality. Before getting into the quality measures and CMS Star Ratings, I will first go over the facility representation analysis and the health deficiencies. The staffing hours will also be highlighted at the end of this section. Facility representation for facilities with an AAPACN-certified nurse as a share of total SNF facilities has increased 13.2% year over year from 2023 to 2024. Currently, facilities with an AAPACN-certified nurse comprise 15.55% of all SNF facilities. Overall, the quality data and trends are similar to that in 2023 and 2024, and facilities with an AAPACN-certified nurse are demonstrating better quality outcomes across all outcome measures as compared to facilities without a certified nurse. Facilities with an AAPACN-certified nurse had fewer health deficiencies, better scores on the majority of quality measures, and higher CMS Star Ratings in every category as compared to facilities without a certified nurse. Slide 12 here displays our analysis of claims-based facility representation, which use SNF claims data and AAPACN certification data to determine the proportion of SNF facilities that employ an AAPACN-certified nurse. As can be seen in the graph at the bottom of this slide, facility representation has increased gradually between 2022 and 2024, demonstrating a total increase of 18.4% over those 3 years and an increase of 13.2% year over year from 2023 to 2024. This slide shows where the increase in facility representation occurred, stratified into quintiles based on the size of the facility as measured by the number of beds. From the graph at the bottom, you will notice that representation for facilities with an AAPACN-certified nurse has increased in all quintiles except the smallest facilities since 2022. The first quintile has noticed a slight decrease of 3.67% over the 3 years of analysis and a 2.1% year-over-year decrease between 2023 and 2024. However, facility representation is increasing markedly in the medium-sized facilities, represented by quintile 2, 3, and 4. Over the 3 years of our analysis, quintile 2 has increased the most, with a 30.5% increase since 2022 in the number of facilities employing an AAPACN-certified nurse. Quintile 3 increased 26.5% since 2022, with the majority of that increase coming in the last year, as there was a 22.4% increase in facility representation within this quintile from 2023 to 2024. This represents the largest year-over-year increase for any quintile in our analysis. Quintile 4 also outperformed the overall increase detailed on the previous slide, with a 19.31% increase since 2022. The largest facilities, represented by quintile 5, showed an increase of 14.54%, slightly below the overall facility representation increase of 18.4% that I went over on the previous slide. Health deficiency results across all years of our analysis were better for facilities employing AAPACN-certified nurses. Overall, you will notice in the graph that both the number of facilities with a health deficiency and the number of average health deficiencies per facility have increased for both cohorts since 2022. This is likely due to increased attention on health deficiencies from CMS over the last 3 years. Yet, facilities employing an AAPACN-certified nurse have maintained their advantage, with 10% fewer average health deficiencies per site in 2024 as compared to facilities without a certified nurse. We will now transition to our analysis of quality measure scores. Facilities with an AAPACN-certified nurse scored greater than plus or minus 2 percentage points on 7 of the 18 quality measures analyzed. An additional 6 of the quality measures were within that plus or minus 2 percentage point range, with facilities employing an AAPACN-certified individual demonstrating better results in 3 of these quality measure indicators. Overall, facilities with an AAPACN-certified individual demonstrated better results on 10 of the 18 quality measures. Furthermore, facilities with an AAPACN-certified nurse showed improved results in 12 of the 18 quality measure indicators as compared to our 2023 analysis. The visual on this slide shows the quality measure scores between 2023 and 2024. The green boxes indicate the quality measures that were plus or minus 2 percentage points better for facilities with an AAPACN-certified nurse. The blue boxes indicate the opposite, where facilities without an AAPACN-certified nurse demonstrated better results that were plus or minus 2 percentage points better. Finally, the gray boxes signify the quality measures that were within the plus or minus 2 percentage point cut point. The stars in some of the boxes highlight the quality measures that demonstrated improved results from the previous year in facilities employing AAPACN-certified nurses. You will notice from the visual that catheter and long-stay antipsychotic medication measures moved from the statistically better to not significant band, while exaggerated weight loss moved from statistically worse to not significant. The following quality measures showed improvement from 2023 to 2024. improvements in function, long-stay pneumococcal vaccine, short-stay antipsychotic medication, short-stay flu vaccine, short-stay pneumococcal vaccine, catheter, exaggerated weight loss, help with daily activity, falls and injury, incontinence, independent movement, and urinary tract infection. One thing to note from the quality measure analysis is that proper coding procedures, which are a staple of many AAPACN certifications, can actually hurt quality measure scores because it appears in the data that there are higher incidence rates for some of the quality measures if you do not code properly. For example, falls and injury, catheter, and urinary tract infection are often improperly coded in facilities where nurses do not have specialized training in coding procedures. This improper coding can make the incidence rates for these indicators in particular seem lower than they are in actuality, leading to better quality measure results. Slides 17 through 20 will highlight different CMS Star Ratings analyses. We begin here on slide 17 with the CMS Star Ratings by category from 2022 through 2024. Overall, the trends for 2024 remain consistent with previous years, where facilities with an AAPACN-certified nurse demonstrate better results across all CMS Star Rating categories. As mentioned during the executive summary section, you can see the downward trend in CMS Star Ratings results across all CMS Star Rating categories for both facilities with and without a certified nurse. It is our belief that this is due to CMS's methodological changes in how they evaluate star ratings, as opposed to any general decline in quality of care at skilled nursing facilities. In terms of the overall star ratings, facilities with an AAPACN-certified nurse possessed a star rating 11.9% higher in 2024 than facilities without a certified nurse. The larger differential across all years of this analysis was in the staffing rating. In 2024, facilities with an AAPACN-certified nurse had a staffing rating that was 16.1% higher than facilities without a certified nurse. The long-stay quality measure rating was the most evenly distributed across all years of the analysis. In 2024, the long-stay QM rating was equivalent between facilities with and without a certified nurse. However, when we extended the decimal point out to the 1,000th place, we were able to determine that facilities with an AAPACN-certified nurse still had a higher rating in this category as well. Slide 18 demonstrates the average overall CMS star rating by facility size, as determined by the number of beds in each facility. As can be expected, the smallest facilities had the highest overall star rating, while the largest facilities had the lowest overall star rating. This trend is consistent across all years of our analysis. In 2024, the largest differential was in quintile 3, where facilities with an AAPACN-certified individual had a rating 20.5% higher than facilities without a certified nurse. The results from quintile 3 are particularly important because this is the quintile that demonstrated the greatest year-over-year increase in facility representation between 2023 and 2024. This graph demonstrates the distribution of facilities by overall CMS star rating. As you can see, facilities with an AAPACN-certified individual are highly concentrated in the 4 and 5-star CMS star rating bands and greatly outnumber the facilities without a certified individual in these higher star rating bands. Conversely, facilities without a certified individual are highly concentrated in the lower star rating bands. The largest concentration of facilities with an AAPACN-certified nurse was in the 5-star band, with 23.3% of facilities. Contrarily, facilities without a certified nurse had their highest proportion of facilities in the 1-star band, with 25.8% of facilities represented here. This analysis and graph, more than any other throughout our report, highlights how AAPACN certifications directly contribute to better care quality outcomes. Slide 20 here is very similar to slide 17, examining CMS star ratings by category. However, this analysis looks at the impact that having more than one AAPACN-certified nurse has on star ratings. Again, the trend within this analysis is consistent across all years, where having 2 or more nurses with an AAPACN certification increases the CMS star rating of a facility across all CMS star rating categories. We end the quality outcomes section by looking at nurse staffing hours per patient per day. We further stratified our analysis to examine staffing hours per patient per day by type of license. In every category except LPNs, which was 1.14% lower, a very menial difference, facilities with an AAPACN-certified individual had higher staffing hours per patient per day. Total nurse staffing hours were 5.1% higher in facilities with an AAPACN-certified nurse, with particular attention being paid to registered nurse hours, which was 14.3% higher for facilities with an AAPACN-certified nurse. The difference in RN hours is particularly important given that these nurses are typically the most well-trained, with the highest level of educational attainment and the deepest knowledge base. This concludes the quality outcomes section of the presentation. At this time, I will transition our analysis of the financial outcomes. This section will begin with our staff turnover analysis before moving into our census and profit margin analysis. We will then go over civil monetary penalties and denied claims before concluding with our value-based purchasing analysis. We decided to include staff turnover in the financial section of the report because of the increased cost burden nursing turnover has on facilities. From our qualitative analysis, we found that nurse turnover can cost $20,000 to $30,000 per nurse. This makes retaining qualified nurses all the more important to reduce a facility's cost burden. Our qualitative analysis also highlighted that one way to retain staff is to invest in their education to get an AAPACN certification. The cost of hiring and onboarding new staff is roughly more than 6 times greater than the cost of paying for an AAPACN certification for a facility's nurse. Facilities with an AAPACN certified nurse had higher retention rates for total staff at 53.8% retention and RN staff at 59.6% retention, as compared to facilities without a certified nurse, which had 50.7% retention and 53.4% retention, respectively. Slides 24 and 25 will provide these staff turnover statistics. The post-COVID-19 period proved to have high nursing turnover rates as the sector experienced a nursing shortage, coupled with the increased burden of having to manage a once-in-a-lifetime pandemic. Within our analysis, 2022 had the highest nurse turnover rates of all years, and the turnover rates for both facilities with and without an AAPACN-certified nurse have been decreasing since that year. Overall, turnover at facilities with an AAPACN-certified nurse has decreased 7.3% since 2022, while facilities without a certified nurse have experienced a decrease of 9%. The higher decrease for facilities without a certified nurse is mostly attributable to the fact that their turnover in 2022 was exceptionally higher, making it more likely that they could have a notable percentage decrease over time. Still, facilities with an AAPACN-certified nurse have demonstrated less turnover in every year of our analysis, with turnover being 6.4% lower in 2024 for facilities with an AAPACN-certified nurse. Facilities with an AAPACN-certified nurse have shown noticeable improvement in retaining registered nurses. Since 2022, RN staff turnover at facilities with an AAPACN-certified nurse has decreased 14.3%, while facilities without a certified nurse have experienced a 12.6% turnover decrease. In 2024, RN staff turnover was considerably lower at 14% for facilities with an AAPACN-certified nurse as compared to facilities without a certified nurse. These lower turnover rates have the potential to produce significant cost savings for facilities with a certified nurse. Census, or facility capacity, can be used to determine a facility's reputation in the field while also being demonstrative of the preferred provider relationships they have with transferring providers. Census ratios are generally linear, where facilities with higher CMS Star ratings have higher census, leading to increased operating revenue. We also found that census has increased for both cohorts since 2022, as we have moved temporarily further from the COVID-19 public health emergency. Facilities employing AAPACN-certified individuals had higher census across all CMS Star rating categories as compared to facilities without a certified individual. Slides 27 through 29 will depict the graphs related to our census analysis. This graph presents overall facility capacity between 2022 and 2024. As is documented in the graph, census has increased every year since 2022, and facilities with an AAPACN-certified individual have demonstrated greater census increases in those 3 years as compared to facilities without a certified individual. Facilities with an AAPACN-certified nurse have seen their census increase by 7.9% over the 3 years of our analysis, as compared to just 6.9% for facilities without a certified individual. As can be expected, facilities with higher CMS Star ratings have higher census rates. No matter the CMS Star rating, facilities with an AAPACN-certified individual have higher census. We also note that simply having an AAPACN-certified individual on staff accounts for a higher census proportion. You will see in the graph that facilities with an AAPACN-certified nurse and a 3 CMS Star rating have higher census across all years than a facility without a certified individual and a 5-star rating. The same is true if we examine a 2-star facility with an AAPACN-certified nurse versus a 4-star facility without a certified nurse, and so on. While we are performing our analysis, we examine the census numbers by all CMS Star rating categories to see which of the individual categories correlated most strongly to having higher census rates. The answer was that the quality measure star rating is correct. As you will note, this graph for the QM rating has a strikingly similar trend to that of the overall star rating from the previous slide. As such, all of the analyses I mentioned on the previous slide 28 hold true for this quality measure rating census analysis. Slide 30 depicts the net profit margins for facilities with and without an AAPACN-certified nurse. Like many healthcare facilities, skilled nursing facilities were hit especially hard by the COVID-19 public health emergency, with negative net margins in 2022. 2023 saw some economic stabilization, as the overall industry had roughly a net zero profit margin. In 2024, the economic situation continued improving to where we are now seeing overall positive net margins for facilities. In every year of our analysis, though, facilities with an AAPACN-certified nurse have seen lower net profit margins than facilities without a certified individual. Yet, the margin analysis does not tell the entire story about whether investing in AAPACN-certified nurses produces meaningful financial results. Numerous factors go into profit margins, such as parking and gift shop revenue, which cannot be directly attributable to a nursing certification. Secondly, as I mentioned in the executive summary section, civil monetary penalties are typically not accounted for in the SNF cost reports in a given year, as they take months to years for a facility to eventually be hit with a penalty, especially if there's a lengthy appeal process. Therefore, that added cost of having a penalty will not display itself in the cost report for the year that that penalty is assessed. Similarly, a facility earns a value-based purchasing reimbursement in 1 year, but it takes 1 or more years for the facility to actually get the revenue related to that reimbursement. So, for instance, if a facility earned the value-based purchasing reimbursement in 2022, it is likely it will not be factored into the cost report revenue until 2023 or 2024. These lags in costs and revenue make margin analysis an imperfect science, although it can provide us with a good snapshot of how a facility is performing financially. I mentioned on the previous slide that civil monetary penalties typically do not get factored into costs for the year in which they are assessed. Through our analysis, we have found that facilities with an AAPACN-certified individual consistently demonstrated fewer incidence rates of civil monetary penalties. Because of this, the average fine per facility is lower for facilities with an AAPACN-certified nurse versus facilities without a certified nurse. In 2024, 22.01% of facilities with an AAPACN-certified nurse were assessed a civil monetary penalty as compared to 25.02% of facilities without a certified nurse. The average fine per facility was roughly $2,000 lower for facilities with an AAPACN-certified nurse as compared to facilities without a certified nurse. The next slide presents our stratified analysis of civil monetary penalties. Looking at the top row of the table, we can see that facilities with an AAPACN-certified nurse have fewer incidences of civil monetary penalties. And the second row details the fine per facility, which is also lower for facilities with an AAPACN-certified nurse. We also stratified our analysis into fines per bed day, and fines per patient, using discharges as a proxy to determine the number of patients in a facility. By any metric, facilities with an AAPACN-certified nurse have lower civil monetary penalties than facilities without a certified nurse. The bottom four rows of this table include only facilities that were assessed a civil monetary penalty. In 2024, although the proportion of facilities with an AAPACN-certified nurse that were assessed a penalty decreased modestly from 22.07% in 2023 to 22.01% in 2024, the amount of the fine increased. This fine increase is true for both facilities with and without a certified nurse. There are pretty substantial increases in the median fine per facility, with a roughly $6,000 increase and average fine per facility of greater than $10,000 when comparing 2024 to 2023 data. Again, this holds true regardless of whether the facility had an AAPACN-certified nurse or whether they didn't. We see a $6,000 increase in the median fine per facility and roughly a $10,000 increase in the average fine per facility. Slide 33 highlights our denied claims analysis from 2022 to 2024. One thing to note about the denied claims analysis is that it only examines Medicare claims data, meaning that private insurers and Medicaid as the primary insurer will not be captured in this data. Overall, we are seeing that incidence rates of denied claims have fallen over the 3 years of our analysis. In both 2022 and 2023, facilities with an AAPACN-certified nurse had a lower rate of denied claims than facilities without a certified nurse. However, in 2024, the results have flipped, where facilities without a certified nurse had lower rates of denied claims. Despite this, there is a noticeable 16.3% decrease in the denied claims percentage for facilities with an AAPACN-certified individual. The final financial metric we analyzed was the ability of a facility to earn a value-based purchasing multiplier. In both 2023 and 2024, facilities with an AAPACN-certified individual earned a VBP multiplier were 21.1% more likely to earn this multiplier than facilities without a certified individual. Importantly, the ability to achieve a value-based purchasing multiplier for facilities with an AAPACN-certified individual has increased 32% year over year from 60.22% of facilities in 2023 to 79.47% in 2024. This is an important indicator of both the quality of care in the facility and also the ability to attract increased revenue via reimbursement payments. That brings us to the end of our outcomes analysis. As a final reminder, this presentation does include an appendix starting on slide 37 that I will not be highlighting as part of this presentation. I encourage you to view it on your own time to see the calculations performed to arrive at our final outcomes and to view the themes uncovered as part of our qualitative work. Here, we will briefly conclude with some of the core themes of our analysis. First, and potentially most important, facilities with an AAPACN-certified nurse demonstrated a higher quality of care, as evidenced by the higher CMS Star Ratings and better quality measures as compared to facilities without a certified nurse. The better quality of care leads to an enhanced reputation in the field, which allows facilities with AAPACN-certified nurses to establish preferred provider relationships with transferring institutions and better market themselves to individuals seeking care for their family members. The reputation and relationships that come with it make facilities with an AAPACN-certified nurse an attractive place to receive care, contributing to higher census or facility capacity than facilities without a certified nurse. While we noted that facilities with a certified nurse had lower net profit margins, there are other financial metrics that demonstrate that investing in AAPACN certifications for nurses presents a positive return on investment. First, staff turnover is much lower for facilities with an AAPACN-certified nurse, which can contribute to reduced facility costs. Secondly, facilities employing AAPACN-certified nurses have fewer and less severe civil monetary penalties. Finally, facilities with an AAPACN-certified nurse can increase revenue by consistently earning a higher VBP multiplier, bringing in more reimbursement revenue. We expect that as we progress through the years, that we continue to see an increase in net profit margins at facilities with AAPACN-certified nurses, while these facilities maintain the other positive financial metrics we have covered in the previous section of our presentation. I want to thank you on behalf of my colleagues at Dobson DaVanzo and our associates at AAPACN for viewing this presentation. Should you have any questions about the presentation or our data analysis, you can always reach out to me at michael.bynes@dobsondavanzo.com or via phone at 703-260-1769. Again, thank you for viewing the presentation, and I hope you have a wonderful rest of your day.